Well, what a wonderful turnout. Love to see all the fund holders on the line and private foundations. Thank you for joining us for this conversation. As you well know, the Community Foundation, we are just so privileged and proud to serve more than 250 families and individuals and businesses who love this community and are generously supporting it, and the nonprofits that make us strong. As you may recall, for those of you who are with us at our annual luncheon, our theme was Better Together. And boy, we sure did not see what was coming down the pike in March, but we're grateful to be able to work alongside all of you and such an important time in our community. You know, over the last 5 months, if you think about it, our cities and counties and state and nationally, we've all been so hard hit by COVID. And for the last 5 months, we've also seen our nonprofit leaders really step up to the plate to serve vulnerable families and individuals. And we can't say enough good things about what you all have helped us accomplish here in Tarrant County. If you add up the funding that's gone out the door from private foundations and community foundation donors, it's in excess of 8 to 10 million that was donated between April and July. So just think about that impact and being able to get those funds out the door. I know at the Community Foundation, Vicki Andrews is our wonderful Director of Donor Relations, and Garrett March were able to work with our fund holders to contribute over $1 million to COVID-specific relief, and then millions more in general operating support. And that money went out, you know, at the direction of our donor advisors at their recommendation, because they wanted to make sure the nonprofits they love could see this through. So that's all just been tremendous. But now we've got to move from emergency response into long-term recovery. And so to do that, we've got to have a long-term view and big picture approach and really align our efforts wherever possible. So that's why I just can't tell you how happy I am that we all have the benefit of being able to visit with Tom Luce and his team today. Tom's personal and professional accomplishments speak for themselves. They're known far and wide, and I know they make him a hero to many of us on the line, me included. If you look back at his career in public service, not only has he had countless appointments on the state level and nationally, including serving as Assistant Secretary of Education to President George W. Bush, but he also has diligently applied himself to emerging issues and been on the ground floor. So if you think about it, Tom, I think it was 20 years ago plus when you first put the beat on early learning. And I'll tell you what, in this community, it's taken fire. And, you know, but you were at the forefront there. If we look at math and science and STEM education, Tom was the founding CEO of the National Math and Science Institute. We're all going to be overwhelmed and feel like real failures as I go on, but I'm going to add one more, and that's the focus on mental health. And we saw over the last legislative session, it became a real priority, and that's not by accident. Tom worked with the Meadows Foundation to form the Meadows Mental Health Policy Institute. Really groundbreaking work. So in 2016, Tom put a beat on what we would look like 20 years from 2016 on. That was 2036. That's where the name Texas 2036 comes from. And it really was Tom recognizing that all these issues were interconnected and we needed to have a long-term view. So again, could not have a better person on the line today to speak with us. Tom, let's kick this off. And can you share with us your kind of opening thoughts about Texas 2036 and where we stand today?
Well, actually in 2016, I basically thought to myself, we'll probably have a global pandemic in 2020. And so I better form Texas 2036 so we can be ready.
On the case.
Yeah. But, you know, in all seriousness, in 2016, I was really struck by a sense of overwhelming gratitude for the life that I'd been able to have being born and raised in Texas when I was. And I became profoundly understood that the abilities that I've had to raise a family and build a law firm and engage in public service and, you know, get many helping hands to move forward. I realized and became concerned about the fact, what would the future be for my grandchildren and their children? And I think back to the growth of North Texas. You know, when I was born, this will really give away. Of course, Margaret Spellings publicly announced I turned 80 on June 18th. But when I reflect back on where North Texas was in 1940 and where we were in 2016, it was remarkable, the transformation that we had. But the issue in my mind would be, where would we be 50 years later, 20 years later? And I became overwhelmingly convinced that what had happened was not by accident. It had happened because a generation of leaders before my generation had invested in the future and thought about the future. They made a lot of mistakes, that's clear, but they also did a lot of things that transformed our community. For instance, I often think about Eric Johnson and the ability to bring together Dallas-Fort Worth and build the Dallas-Fort Worth Airport. Eric Johnson built water reservoirs which supplied water for North Texas for generations. I remember generations that donated land for the construction of the interstate highways. And so I really began to worry about, were we really thinking about the future? In the second sense that I've been overwhelmed by, and you mentioned it, Rose, I've worked on a lot of different areas of civic engagement. And I was struck by the fact, finally, that in each of those areas, I had been advocating in what I call silos, meaning I'd go to Austin and say, okay, I think we need to build a medical school in Fort Worth, or we need to build a new transportation system to do X, or we need to improve higher education, or we need to improve mental health. But at the end of the day, I think all of us who work on these issues that impact the entire community, we eventually find out everything's connected to everything. Children who are healthy are better educated. Children who are better educated are more healthy. You can't be more healthy if you can't get the health care you need, and so on and so on. And there was a song, I don't know, 40 or 50 years ago, again, I'm giving away my age, something about when the hip bone's connected to the thigh bone, connected to the ankle bone. Well, everything's interconnected, and people live in systems. And our public sector is made up really of large systems that are hard to change. The K through 12 system, the higher education system, transportation is a large system. You know, just take public education and just the K through 12 system, not counting childcare. We try to educate 5.5 million children in about 8,600 campuses. Well, I learned the hard way, you can't change that system overnight. And so I came to the conclusion, one, everything was interconnected. Number two, real change occurred incrementally over time. Therefore, you had to build public support to support consistent, disciplined investment in things that work. The other thing I learned the hard way, and I learned this in education, without data, you're just another person with an opinion because everybody went to school, so everybody's an expert on education. And therefore, I felt like data was important. And for instance, we used data successfully to advocate for change in the mental health system. So all of that caused me to form Texas 2036 and to travel the state to make sure that, one, nobody was already doing this. There's plenty to do without reinventing the wheel. Number two, I wanted to make sure we could build a bipartisan, nonpartisan coalition to try to bridge the partisan divide that I saw occurring in Austin, Washington, and throughout the country. And the last point I would make is that then I also came to the conclusion that real change in the magnitude we all want really only occurs when top-down efforts, meaning state policy, and local efforts meet midway. And what I mean by that was really struck home to me in a conversation with Melinda Gates about a year ago. She said to me that the Gates Buffett corpus of their foundations combined was spent in 2.5 years of the California education budget. Now stop and think about that. That's the Gates Buffett Corpus Foundation. And so they decided even they had to be concerned with, if they wanted to change education, they could only get so far if they weren't trying to make sure that the top-down portion that impacts our systems was at least not pulling against their efforts. And so it takes both. We live in a very diverse state, and that diversity means we have to have energetic local efforts. But again, if you're trying to change education, or you're trying to change health, or you're trying to change social mobility, you can't do that if state policy is pulling against you. And then lo and behold, COVID hit. And COVID, to me, the closest, first of all, having lived as long as I did, the other mistake I made, I probably whispered to somebody sometime, I may have seen it all. Well, I haven't. And I was probably the curse that brought COVID, because I have not seen anything like this hit our entire state as suddenly and with such impact as COVID did. I was heavily involved in Hurricane Harvey recovery. I've been involved in a lot of problems that occurred in our state, but the enormous economic dislocation that we've suffered in COVID really was something unlike I'd seen in terms of the suddenness of it. I think that was compounded by the cultural divide, the racial divide. It's kind of what I call the perfect storm of 2020. It was the pandemic anxiety. It was the social media environment in which we live, political divide, the lack of public leadership. It all came upon us at the same time. And I'll go back to that Hurricane Harvey analogy. You know, when we went through Hurricane Harvey, we had to first focus on the fact we had to get people off the rooftops. That's what we've been trying to do the last 4 or 5 months. But now we have to rebuild, and we may face another hurricane this fall, in terms of whether you call it a second phase or just failure to completely deal with phase 1. We're not necessarily through with the hurricane, or else, let me put it this way, the hurricane may not be through with us. And so you put all that together, and that is really what led to the effort on Texas 2036 to really look at what we considered, and it's a subjective judgment, to be the 6 main policy areas that really drive more social mobility, closing the wealth gap, closing the income gap, closing the healthcare gap, education gap. And those 6 areas were education and workforce, healthcare, justice and safety, infrastructure, natural resources, and government performance. And let me say this, we're seeing in the government performance arena how important that was. For instance, in trying to help people in the fallout from COVID, Congress passed extra unemployment benefits. Well, our workers' compensation computer system crashed, and we couldn't disperse those funds quickly enough. Well, that's a lack of government performance. And whether you think government ought to be big, small, or medium size, I think we could all agree government should work on the efforts that they undertake. And we've got a long way to go in that regard.
Do. And Tom, if anybody can take on government, I think it's you.
Well, that's enough preamble, but where is the best way to take it from there, Rose? You and I have talked about this a lot.
Actually, let's lift up first. I know all these issues are intertwined, and we don't want to have a siloed approach. But I think it does help to first look at. Let's take a look at education, and think about what was one of those pre-existing conditions that got really exacerbated by COVID. And actually, I'd like to think about how it could actually too be a solution. So if we were to look at the digital divide, and if you could talk about what you're seeing on the state level with the lack of digital access in education and what that means on a state level. And I know locally, Elizabeth and the team have been working very hard to provide access here to public schools and charter school students. So can you comment on that?
I absolutely can. And let me say again, it's like the hurricane. It didn't create the digital divide. It revealed how stark it is. Let me give you the numbers. 5.6 million public school students, 1.8 million did not have sufficient digital connectivity in the spring semester. Just think about that. 1,800,000 kids could not be properly educated virtually. And so we feel strongly we have to really tackle statewide making broadband affordable and accessible. But number two, I want to also say that COVID did not create the fact that our Texas public school system for about 20 years was leading the nation in increase of academic achievement of our African American and Hispanic students. But in about 2010 to 11, we began to decline again. And therefore we were already declining prior to COVID. And that won't work in our state. It just flat will not work. And we cannot allow that to persist, notwithstanding the pandemic.
Yeah, and I think about how in the opportunity lane, if providing broadband digital access and devices to students could actually enable us to ensure that every child has access to an excellent calculus teacher, no matter where you lived. I think there are ways to push through and leave us better off than we were pre-COVID.
It can, but that's a central point I want to make, Rose. To me, the pandemic is going to create transformational opportunities, which can be good or bad. And I'll give you some examples. Let's take education and health. And in the education arena, the barriers to virtual education were basically breached overnight. And the walls, the resistance to virtual education, the opportunities, et cetera, were breached. Well, are we going to go back to the same old methods? I served in the Library of Congress board 30 years ago, and they created all sorts of wonderful digital products for teachers to use throughout the nation, but they weren't being used. So the question is, how do we take advantage of, in the good sense of the word, the opportunities that have presented themselves, or are we going to go back to the old ways? And I think the only universal agreement I can see about the impact of COVID by most analysts is that everything we thought might happen over the next 20 years, all of a sudden compressed into about 2 or 3 months. I'll give you another example. I talked to the head of MD Anderson last week. Again, probably the world's leading hospital on cancer. They went from 0 telemedicine calls daily, and they're treating cancer, all sorts of complex cancer situations, to 8,500 telemedicine calls a day. Well, that's not going to go back, I don't think. But how do we make sure that that's sustainable, it's quality, we know how to measure it? What changes does that dictate? And I think we're going to see a lot of that in education and health.
Well, and Tom, actually, that's an excellent point to pivot and turn over to Elizabeth Brands. So Elizabeth leads education giving for the Morris Foundation, and again, the Reed Fort Worth third grade literacy program. Elizabeth, can you talk about how that's manifesting, the issue Tom is talking about is manifesting here in Fort Worth?
Yeah, thank you, Tom, for your comments. And I particularly enjoyed your analogy of the hip bone being connected to the thigh bone. That really resonates with the work that we're seeing in Fort Worth, in that this is all very interconnected. When your hip hurts, your knee hurts, and that's what families are facing now too, because of the consequences of health directives caused by COVID. And the points about the technology devices and internet certainly resonate. That, in going back to March, was one of the key things that we look to tackle in Fort Worth, knowing that access to having in your home a computer device as well as internet is now becoming an item that should be added to the basic back to school supply list, because it's the gateway between a child being able to be in their home and to access learning in their classroom. And so some of the things that we are seeing in Fort Worth that really seem to work well initially, and then kind of I'll segue into some of the things that we know we're going to need to be visiting long term, are really that redeployment of devices and internet into homes. And we really looked at that from a layering approach of a public-private partnership, of first utilizing all the resources that were currently available to us within Fort Worth ISD and getting those out to kids and families in their home. And then where there were gaps, and in the district, there were thousands of kids, about 8,000 elementary school students, that said that they needed internet access in their home. That's where we turned to looking first for state and federal dollars, then layering on those corporate dollars, and finally going to philanthropy to make sure that every child in their home had access to internet. That's a solution that'll last us about a year. So that'll get us to almost the next school year. And simultaneously, we're going to need longer term solutions, which is the conversations that you're mentioning about broadband. And those things, we're really looking at an approach that's on an even larger scale than just within our own city, but definitely county and statewide, where there's more economies of scale and being able to get those RFPs and broadband lines that we need in home. But also, we know that we can't neglect the investment that has already been made in millions of dollars of technology going from schools and into homes. And so we're also really investing in how do we support parents and students in fully utilizing and capitalizing on the millions of dollars of technology that have gone into homes. And I think we can all relate to this, as we have all switched from in-person meetings to these kinds of meetings where, you know, how do you use Zoom? How do you log in? Has been a learning curve for all of us. And those same things are what students and families are experiencing, as for the first time ever, they've had to figure out a password for getting into their classroom, or they've had to figure out a new website to go to. And again, using that analogy that Tom gave of, you know, if the hip bone hurts, the thigh bone hurts, this is just piled on to the other economic consequences that COVID has had on these kids and families, compiled with the fact that kids are at home all day now with whomever is in the home. And I think we can too kind of all relate to the monotony of that when you as a parent aren't getting that break, plus you are now tasked with that homeschooling role. So our long-term solutions are going to have to be continuing to support parents, especially for those younger grade of kids where distance learning is particularly hard, and giving them the tools and resources to use the technology, not only because that is now the gateway to learning for their children, but also because we want to maximize the public-private partnership investments of millions of dollars that have been spent to purchase and deploy these devices. And simultaneously, we're going to need to look for sustainable solutions. And I think that's where Rose is getting, that there's an opportunity here for us to really make sure that we are creating something better than we had when this pandemic began. And potentially one of the wins that we can get here is to have long-term broadband access in more homes, knowing that that's not just important for child learning, but it's important for the parents and the family's sustainability and health. And internet is, you know, a critical resource for accessing job interviews and applications and all those things too, that we know create strong, healthy, and sustainable families. And that has a trickle effect into what kids are learning and academic outcomes for kids in classrooms.
Thank you, Elizabeth. And I've just been so impressed to watch how holistic the approach has been around education here, and recognizing that many times there are vulnerable families that need a whole host of supports. And how do we coordinate those in a way? I know you coordinated with Fort Worth ISD to do a front porch campaign to meet families on their porches and deliver the resources they needed. Really innovative thinking. And I encourage for all of us, we get so used to our own system and procedures that is as much as we can be flexible at this time, I think we can really find some great solutions that are out there. I could talk about this subject all day. Yes, Tom?
Let me add one thing.
Yeah.
Let me add one thing to what was just said, though, and it shows the importance of thinking short-term, medium-term, and long-term. You're absolutely correct. We have to utilize what we've spent the last 5 months putting in place and focusing on parents and students. But think about it, we're going to have to make the same investment in educators and teachers about how to use this new technology. If the devices and the tablets serve as modern versions of the blackboard, you're not really utilizing the new technology. You're putting a Band-Aid on the situation. And our educators haven't been trained nor really thought about what are the changes that are brought about by having the capacity of this technology. And so that's going to be a longer term issue and a medium term issue. And that's the reason why we think it's so important to think through so that these changes are cumulative on top of each other and truly result in a transformation of how we teach youngsters.
Sure. So with that, I think education, we can lead directly into economic development. And I know that we've had good conversations in the past about how important it is that this pipeline be laid. And around, that there are critical issues out there as we look at unemployment rates right now. I believe Texas 2036 was projecting the need for about 8 million additional jobs by 2036 in order for our economy to be healthy. Can you talk about the short-term impacts on our economy and how you're seeing that play out?
I can, and let me talk pre-COVID and post-COVID. First of all, I want to say pre-COVID, we were basically at full employment. And by that, I mean, we had more jobs unfilled statewide and in Tarrant County than we had, I've forgotten how I started that sentence. We had more jobs available than we did unemployed people. And so we were at full employment. And so that's going to, hopefully, we'll reach that when we reach the new normal, we're going to run out of workforce again. And again, it's because of the mismatch in terms of job skills with the jobs that will exist in the future. For instance, the #1 job category in the United States by Bureau of Labor Statistics today is still the cashier job. Well, guess what? Cashier jobs are probably not going to exist in the really short-term future. They're not going to exist. And so what does that mean for the education workforce pipeline? And so we think it's very important to start thinking about what I call the birth to death. I think I need to call it something other than birth to death. But if you stop and think about it, our child care system is part of our education system. Our upskilling and reskilling after you get a certificate, after you get a technical degree, after you complete community college is going to become more and more important. And so as we think really about the long-term pipeline, we have to get more focused. And I think that is something we've developed a very unique tool that maybe John can share with you that we've constructed for every county in the state, including Tarrant County, that'll help you really help students, help schools, help workforce, help employers really understand what the situation is in Tarrant County. You can, for instance, pull up on our website and see exactly how many students graduated from Fort Worth ISD in X year and see what happened to them, how many graduated from high school, how many went into higher education, how many ended up making below a living wage, above a living wage. You can follow their pathways and see what happened. And if you begin to analyze this data, you can really plan for the future And you can also show individual school districts, for instance, not on this chart, but another, you can actually see what happened to every Fort Worth ISD graduate. Did they go to which community college? What was their GPA? Did they complete 30 hours of degree work? In other words, the data is there to be able to follow exactly what's happening today. And our next step is to be able to project the workforce of the future so that, again, keep in mind, the lead time in our education system is a long time. And so if we decide we need more X jobs in 5 years or 7 years, we've got to start now to encourage middle school students to take the right courses to know how to fill those jobs of the future.
Yeah.
So there's a lot of work to be done, but there's a lot of data available that can help navigate that. And
what I love about this, and we'll refer everyone and share the link to Texas 2036 website. But what's fantastic about this is you can drill into this level of granular detail. And I think not only is that helpful to us as grant makers and donors, but it also helps our system stay accountable if the information is that transparently available. And we're able to keep a beat on, where the trend lines are running. So
plus,
Tom,
let me say also, by the way, it gives real-time information to counselors who can say to a student, let me show you what happens if you take this pathway versus this pathway versus this pathway to your earnings and employment opportunities.
It's fantastic.
That's a real-world conversation a counselor can have with parents and students as they determine their future.
Yeah, well, that's actually a perfect tie-in to Garrett March, who is at the Community Foundation and has guided our COVID-related grants as well as all of the grant cycles that we manage at the Community Foundation. Garrett, can you comment on this and that importance of industry leaders and nonprofits and educational systems working together and what's happening right now in Tarrant County?
Thanks, Rose, and thanks, Tom. I appreciate your thoughts on the importance of that short-term, medium, and long-term recovery stages. The latest data we have for Tarrant County from June showed an unemployment rate of 8.8%, which is an improvement from where we were in May, but that still leaves more than 95,000 people in our county without a job. So there is some good news. As Tom mentioned, we did have a strong economy to start with, and we do actually have companies locally that are still hiring. A couple examples of this is Workforce Solutions co-hosted a virtual job fair with Hillwood this morning, actually. They shared job opportunities for more than 30 local employers who are hiring, especially in the transportation, distribution, and logistic fields that are so critical up in the Alliance area. There are also currently 8,000 positions that are open in the city of Fort Worth on LinkedIn that have just been posted in the last month. We're also seeing businesses really collaborate to keep people employed. This is a great example of that analogy that Tom was giving of the body being interconnected, that when businesses come together like restaurant owners, Tim Love and John Bonnell partnering with the Tarrant Area Food Bank, they were able to keep service workers employed during the shutdown. The food bank had to suspend volunteer use, and with service workers needing jobs, those workers were able to be employed at the food bank as contract labor while they couldn't be at their restaurants. We have the Best Place for Working Parents initiative, developing the Workforce Connector tool to connect businesses who had to lay off staff with others who were looking to hire individuals. Laura will drop the link to that tool in the chat box if you're interested in learning more. And then we also see businesses that are doing a lot to give and working hard to serve our community right now, even though they themselves might be suffering. So for example, Lockheed is providing educational programs in local schools that they're going to have to rethink how to operate in a virtual environment, but that are helping students think about their career paths. Facebook.
Can I interrupt there 1 minute?
Sure.
And one interesting thing, one of the things we do on our COVID tool, and maybe John can pull that up, we show the amount of job losses in every county in the state. One interesting thing is that really struck me, and we characterize the job losses of unemployment measured by people who applied for unemployment. Look how much the decline in air transportation impacted your jobless claims. So Tarrant County has suffered a lot from the decline of the aircraft industry, specifically DFW Airport, I suspect. I mean, we all knew full service restaurants would be hit, temporary help services, service restaurants, but look at number 4, scheduled passenger air transportation. That's a significant impact there, where we really have to focus on how do we take those skilled people and get them reskilled or upskilled, or even keeping the same skills and linked with the right employer. So that's important what you all are doing with Hillwood. And again, this is another way to use data on the Texas 2036 website to be able to leverage philanthropic and business efforts, because it gives them data to direct their efforts.
Great, thanks, Tom. Yeah, I think that's a great point. We have several very large industries based in our region that have taken a really hard hit, and it's not just small businesses, but major industries like the airlines. We do know that corporate partners are doing what they can. We have a number on this call that have been using their foundations or their funds locally to support small businesses. Like Facebook ran a small business grants program through the Protect the Fort program. And we also have local banks working really hard to get Paycheck Protection Program loans out to local businesses to help keep them afloat. So even though we are definitely suffering, we have some really strong corporate partners here who are committed to investing in the community and making our regional economy be successful. We also have a really diverse nonprofit sector, and we have nonprofits like the Community Learning Center, West Fort Worth Center of Hope, the Ladder Alliance, focusing on issues like retraining for trade, professional, IT careers. As Tom mentioned, nothing like this has ever happened before, and nonprofits are having to provide their services in totally new ways in a very fast-moving environment. But as Rose mentioned, solutions can come out of this too. So for example, the Ladder Alliance has actually discovered that they can serve more women with their computer skills class virtually than they could have before in their in-person classes. So I think nonprofits are discovering new ways to do things that ultimately are going to help make them be more efficient. And then as has been touched on several times during this call, that interconnection with education being so critical for the long game of economic health. A good example of this interconnectedness and that incremental change that takes time, as Tom mentioned, is the Tarrant 2 and Through partnership, known as T3. That will be launching this fall in all 21 Fort Worth ISD high schools. And this partnership really involves bringing school districts, colleges, philanthropy, the community together to support students finding clear pathways into post-secondary education or training that interests them through supports like having career navigators in school, having opportunities to do job shadowing or mentoring, and then providing that last dollar scholarship to actually make those educational plans a reality. So all of that is going to help close the gap, but that is a long-term game and helping more students have the credentials they need to be able to fill those jobs that we'll have in the future. So we know there's a lot of challenges, but we also know there's a lot of smart people in our community working hard to think about that long game.
Thank you, Garrett. And I love that connection between what Tom was discussing for the navigators to have access to data about what jobs students, if they, what path they can pursue academically to achieve a certain level of economic success, and to have that real-time information. So valuable.
Using our tool, you can actually look at by community college, every single major, and see exactly how many students are enrolled in that. And you can see what happens if in that major you complete 30 hours, what happens to your earnings and wages thereafter, and your jobs. Are you employed? And so that can be a powerful motivator to a student. I love to go into middle schools and ask middle school kids, how many of you would like to be a millionaire? And they raise their hand. And I said, well, the data shows if you actually pass Algebra 2 in 8th grade, you'll make $1 million more in your lifetime than if you don't. Those are the kind of things we need to show students as to what happens to their earnings and jobs if they take a specific major versus another major. I mean, if they take healthcare or IT work or X or Y or Z, the following things will happen to you.
Well, and the consequences of applying yourself in 8th grade. And that certainly focuses the attention, doesn't it?
It does.
Well, I know we're getting close on time. And I want to make sure we have ample time to talk about healthcare. Not ample time, but we can cover the high points. Can you talk about the issues around accessibility and affordability and how you're seeing that play out in the COVID time and going forward?
Yeah, we're doing a lousy job in our state. That's the bottom line. I would say in this sense, we have a healthcare system that does not provide the right healthcare at the right time, at the right place for the best societal outcome at the lowest cost to taxpayers. That's the bottom line. We unfortunately have too much of our healthcare system devoted to what I call the health sick system. If you get run over by a car, if you get shot, if you have stage 4 cancer, we'll make sure you get care. We don't have enough focus on how do we prevent you from getting breast cancer? How do we ensure if you have breast cancer, we find the lump? And I shouldn't use breast cancer as that example. We finally decided years ago we were going to deal with that by trying to move to the prevention and early stage treatment, but we don't do enough of that in diabetes or mental health or a whole lot of other factors that we know cause the system. You know, we did a state by state comparison of Texas to our competitor states. And in so many categories, we ranked at the bottom of the rankings in outcome. And we spend a lot of money on healthcare. And we already led the nation in uninsured. And let me say quickly, uninsured is not, I mean, insurance doesn't guarantee that you have the healthcare you need at a price you can afford it, that's accessible and affordable. So we've got to tackle transforming the healthcare system to produce the workforce that we need in the future to pay taxes to support economic opportunity and social mobility. So we've got a lot of challenges in healthcare, and for too long we've just tried to ignore it, and it's not going away. It now, for the first time in history, there's some dispute, but in my mind it's clear. In the Texas budget, we spend a greater percentage of money now on healthcare than we do in education. That's the first time in the history of the state budget. And for all that expenditure, we're ranked towards the bottom in healthcare outcomes. That's
Tom, can you share the percentage? This has probably gone up, but can you share the percentage of projected costs of healthcare by 2036?
Oh my goodness. We ran a projection once. I think it would consume, now assuming the trajectory continues, which it won't, it's unsustainable. But if the current trend line continued, it would absorb 74% of the state budget versus 37% today. That's unsustainable. You can't afford it. It would crowd out everything else. Mm-hmm. And so this is a complex issue. And again, our healthcare system is not going to change overnight. And in many things, we do a good job, but in a lot of things, we don't do a good job. And we've got to differentiate between the two. And basically, I would describe what we need to do is to move more of our dollars from stage 4 of disease and conditions to stage 1. And too much money now is spent in stage 4. You know, and I find the old argument about is healthcare a right? It's a false choice. We decided as a society a long time ago, if I got hit by a hit and run driver this afternoon, they're going to take me to the hospital and they're not going to let me die. So they're going to provide health care for me. And the question is, what kind of health care am I going to receive? How much of it do I bear myself? How much does society bear? How much do I have to be incentivized to do X? How much can I save if I do Y? But we have to figure out the complexity of our healthcare system and deal with it, or we won't have the educated, healthy workforce we need.
So Tom, if you think about it, you've laid out some pretty big challenges. And I know Andy Miller and the Morris Foundation have been lead funders trying to address these issues on the healthcare front in Tarrant County. Andy,
Great.
Tell us what you're seeing on the ground and where there are promising opportunities for investment.
Great. Yeah. Well, thank you. And thank you, Tom, for your insights. It's amazing to hear, just how, these systems are so interconnected. And, healthcare is a prime example of that, where when you really talk about healthcare systems, what we're talking about is our medical care system. And if you look at the influence that that has on someone's health, it really only influences about 20% of that. And so you look at other systems like education and access to good, healthy foods and safe communities. And those have far more influence on whether or not someone is healthy than do they have access to a hospital. So I think part of the concern right now with COVID, and we're seeing that just in Tarrant County, is that we already had an issue with uninsured or underinsured individuals and their access to high quality healthcare, and COVID has just widened that gap. So the fear is that the health disparities that we were seeing are just going to get worse. As unemployment increases and is it hovering around 11%, and we have a primarily employer-based, health insurance system, we're projecting, we could see anywhere from 25 to 30% uninsured individuals. And that is not something that our current healthcare system can accommodate. They can accommodate a certain amount of uncompensated care, but that really is going to put those systems in jeopardy because that's not how they're structured. So we need to recognize that the lack of good paying jobs and jobs that bring with it high quality health insurance are going to have an impact on our overall healthcare system. It's going to put a bright light on some of our safety net programs, like our federally qualified health centers or our county hospital, and the care that they're going to be called on to provide for some of our underserved communities. They're going to be even further burdened, and we're going to need to be able to support their needs to think about how they're going to best deliver care in this new environment. I really appreciate you talking about how upstream we need to get, because a lot of that is reflective on our investments in our public health infrastructure. And I think especially with COVID, what we've seen is without a lack of a very strong and comprehensive national strategy to address something like a pandemic, the burden shifts to our local public health authorities to really fill those gaps. And quite frankly, we have not funded our local public health systems to do that in any way, shape, or form. It's why we see the continual challenges with testing, why we see continual challenges with contact tracing, why we still have a public debate around the efficacy of wearing masks in public and the impact that that has on reducing infection rates. We get what we fund, and right now we are getting very poor public health outcomes because we have very poorly funded our public health infrastructure. But again, I think that Tarrant County has done a great job in connecting all of our various healthcare systems to bolster that and provide some of those resources and leadership where we've seen gaps, because we have not well funded our public health infrastructure.
Can I make a comment right there to what you said about COVID
Absolutely.
in general and our public
Absolutely.
health system? And I'm going to get up with my soapbox for a minute. This is not necessarily a Texas 2036 topic, but I've been leading a community effort in Dallas to look at how we can decrease community spread. And the fact of the matter is, you cannot decrease community spread by just flattening the curve. You have to bend the curve downward. And the only way you do that is massively increasing asymptomatic testing. 40% of our community spread occurs by people who are asymptomatic, and they spread the disease, and therefore we continue to flatten the curve at new highs. In my best estimation, probably 3 different times since the COVID outbreak, and we're not turning the curve downward. And therefore, this coronavirus is going to stay with us unless we tackle asymptomatic testing and lab capacity turnaround. And that means also we have to address the fact that COVID has disproportionately, we just need to tell it like it is, it has disproportionately impacted essential workers who are in disproportionate numbers, African American and Hispanic, and they are suffering disproportionately to the Anglo population, which too often their complaint is cabin fever from working virtually from their porch. But that's different than somebody who's working on a landscape crew, is paid by the hour, and has to show up to get paid.
So actually good question, and a good question for Andy. Andy, if there are investors on the line who would like to find good vehicles for supporting testing at this time, particularly for the asymptomatic population that Tom references, where would you point us?
Yeah, absolutely. We're really fortunate in North Texas. There is a developing research study that's happening between Texas Health Resources and Southwestern Medical School, where they are going to be testing approximately 44,000 individuals across North Texas. And it's called the COVID-19 prevalence study. And it's going to significantly increase the number of asymptomatic individuals who are tested. It's going to be representative of the community. So there will be special efforts to ensure that those recruited into this study come from all sectors of society, represent all racial, ethnic backgrounds, economic sectors, because what that really is going to do, it's going to tell us about asymptomatic spread. It's going to tell us about the impact on communities of color and other vulnerable populations. But we just don't know enough. And without things like the prevalence study, we're going to continue to guess at how to best approach this from a public health strategy.
Yeah,
But
Andy,
I would also add there, sooner or later, I think we're going to have to tackle the fact, and there's a lot of employees who work for companies that cannot afford to give sick pay, and therefore they avoid being tested for fear that they test positive. And sooner or later, we're going to have to tackle through charitable aggregations of resources, maybe even debit cards, to say to somebody, if you test positive, you'll get a debit card of X to be able to afford to isolate yourself for 10 days.
Yep. One thing further that you said, Tom, because I do think this does provide us some opportunities. The current context does show us maybe a better way to do things and compress that adoption rate, and that is with telemedicine that you had mentioned before. And we're seeing that both in primary care as well as with mental health services. So we're right now seeing the retooling and building up of infrastructure within various systems to adopt that technology, get the appropriate software and licenses in place. And we're already seeing patients being very eager to connect with healthcare resources through those systems. The hope is that the payers will catch up, and we believe that they will when they see the outcomes that those efforts will generate. And we won't go back. We won't be requiring folks to come in for clinic visits when it's not necessary. We won't need them to come in and pay a $30 copay for a pre-op visit that was just a conversation that needed to be had with a healthcare provider.
But let me say, it's up to us to make sure that it doesn't revert back to the old ways, that the regulatory barriers don't go back up, that the insurance companies are required to pay for those things. We're going to have to be vigilant about that.
Absolutely.
Tom, I would just add here that I know many of us on the line were able to visit with Dr. Flynn at the Fort Worth Medical School a couple of years ago, and he was running the banner, holding the banner high for telemedicine. And I remember thinking that sounded very Jetsons to me at the time. And sure enough, here we are, and it's going to be a part of the solution for the future. Andy and Tom, I know we could have so many more deep conversations here, and we're going to continue with Q&A, but I do want to be mindful of everyone's time. So everyone is welcome to stay with us. Tom and our special guests have agreed to make time to answer any questions that you have, and Laura McWhorter will facilitate that portion of the program. But for now, I just want to give the opportunity to close the program and say thank you to Tom and Garrett and Elizabeth and Andy, and to all of you for participating in today's call. I would say that what we've heard today is we've got the tools, right? We start with the facts, and Texas 2036 is a great place to start to be able to track the issues that are important to you and understand how they're impacting our community. Next is that we are positioned as philanthropists to really provide risk capital to support the development of some pretty innovative and credible solutions for these problems. So that's a place where we can be flexible and nimble, and that's a pretty exciting place to be. But those facts and solutions can only go so far. Our success is going to depend, someone smart said this, and I can't remember who it was, but it's the persistent application of focused resources over a sustained period of time. And that, I think, for all of us to think and to remember that we can get excited about a lot of different things, but to really stay focused on these issues. I know we have our work cut out for us, but I just couldn't be more proud to work alongside all of you on these issues in the weeks and months and years ahead. Next month's program, we're going to be focusing on that Tarrant To and Through program you heard Garrett reference. It's a big moonshot for this community, big, deep investment in making sure our students are prepared for economic success. So look forward to that coming online. And with that, I'm going to turn this over to Laura McWhorter. Thank you all for joining us.
Yes, and I echo my thanks to our speakers today. Very informative, and I do encourage all of you to stay after the program for additional Q&A. Keep submitting them in the chat box. But Bill, I'm going to ask you to pull up a slide real quick. Fantastic. So this slide right here, it highlights our upcoming virtual events as part of our Insights series this fall and winter. We'll be sending out digital invitations in advance of each one of these, but you can visit our website for more information, and we certainly hope that you will join us. Thanks again to Meeting Squad, to Carlo, to Bill for helping us execute this flawlessly. And so now we will move to the after program and the questions and answers. Thank you. All right, we have received a couple of questions that I do want to bring forward. And I am finding it real quick here. It says, there are obviously lots of focus areas on which Texas 2036 is concentrating, Tom. What is the most important one of these? And in other words, if you could only focus on just one initiative, what in your mind would be the best one?
Somebody asked me who my favorite of my 7 grandsons was, and I refused to answer that question. If pressed, I do think education is essential in tomorrow's world and really in today's world. The job market is changing so rapidly, and I do think COVID is compressing even quicker the rate of change, which we all knew was coming. But my goodness, it's accelerated it fourfold. And we've got to really think through, how do we change our education system birth to death?
Yeah. Thank you. So we have another question here from Dina. And she asks, so many states have recently expanded Medicaid through ballot measures. Texas does not do many ballot measures, maybe because it is hard with our governmental structure. What are the chances of a ballot measure to expand Medicaid?
Texas doesn't permit ballot initiatives at the present time, and therefore it's going to have to happen, if it happens, through the legislature. And that's going to require a public awareness campaign about what changes do we want to make in our healthcare system. And that's going to require a lot of conversations across our state. But as the viewer asked or commented, a lot of states have done that. I do want to emphasize one thing. Insurance alone and focusing on the uninsured alone is not the be all and end all of affordability and access to health care. We have many employees today on employer provided health care plans who do not have what I'd call accessible and affordable health care. So just focusing on Medicaid expansion is not necessarily alone the answer to the problem.
Good, thank you. So you referenced just a moment ago that you have 7 grandsons. I'm going to ask you to look into the crystal ball, and we've been doing that a little bit here. But in your mind, what does their future look like here in the state of Texas?
Well, number one, I'd rather be in Texas post-COVID than in any other state. So I want to start with that. And I'd rather be in the United States than any country. But what I've told them since COVID broke out is that, boys, you better be nimble and you better be quick and you better be adaptable, because there's going to be winners and losers and there's going to be transformation that takes place. We suffered an earthquake. San Francisco suffered an earthquake 100 years ago. It rebuilt in a better way. Chicago suffered the fire. They rebuilt in a better way, but there will be transformation. There was transformation when the railroads were built. There was transformation when the internet was established. But we're going to see real transformational change, for good or for bad, at a rapid pace, and you better be nimble.
Good. Thank you. So here is a question, and I know John from your team is also on the call, but what is the opportunity to use data to shape policy going forward?
Well, I'll let poor John, hadn't had a chance to talk. I've talked so much, so I'll let him speak to that, but then I'm happy to chime in later.
Yeah, I think that there's an appetite for data at the legislature right now. To Tom's point earlier about without data, it's just an opinion. I know last session I worked for Governor Abbott, and one of the things that that we were able to accomplish that many of you all are familiar with was the overhaul of the school finance efforts through House Bill 3. And House Bill 3 was not something that happened overnight. It was a multi-year process. But the moment where we really felt like we had the momentum is when we had the firm footing of data that was able to make a compelling argument to everyone on every end of the political spectrum that if we didn't act, if there wasn't this case for action, that if we didn't change the trajectory that we were on, we were going to face a very difficult economic path for the state. So you saw that. You saw 181 to nothing vote for the final bill, bipartisan consensus with the business community joining, the philanthropic community, the civic community, and the political community all joining together to make a large infusion of capital into our schools, also oriented around data-proven programs that we know will improve student outcomes. So when you have the information, when you have the data available, they want it. They want it at all times, in all ways, and they want it to be objective and come to the a lot of people try to use data as to push an opinion. In my mind, having clarity of data and accuracy of data, which is one of the things that we really strive for at Texas 2036, is so important because, I mean, the facts are compelling enough, and we really need to get a lot of change made based off that.
Let me give you one concrete example. A couple of sessions ago, we were able to use data to go to state policymakers and say, look, here's the data. There were only, and I use that term advisedly, 1,781 cases of first episode psychosis reported in the state. All the data and research show that if you waited for treatment of psychosis, to the second or third or fourth results, here's what happened, versus if a person got treatment after the first episode of psychosis. And it's really no different than breast cancer. It matters if you get treatment after a first episode, just like it matters if you find a lump than if you wait for stage 4. With that data, we were able to persuade the legislature to put more funding into treatment of first episode psychosis, which I'm convinced will change lives at a lesser cost to taxpayers and a greater return in a person's life.
Great example, Liz. Thank you for sharing that. Elizabeth, are you still online? Because we have a question for you. Someone has asked the question about the porch visits that you mentioned. They wanted to learn just a little bit more about what that was and what you learned.
Absolutely, yeah. So we gathered input from families across Fort Worth ISD through surveys, through task force meetings, and we found that there were 3 critical needs that families said time and time again that they were looking for. They were looking for tangible instructional items to complement all of the distance learning screen time that their kids were having. They were looking for technology assistance to know how to use those devices that the districts had given to them to use in their homes. And they were looking for social emotional supports for their kids and families. So we worked closely with Fort Worth ISD to target, using data, a target population of students who met a number of qualifications that we used to define our target population. It was kids who we looked at their academic grades in the spring and March before school closed. We looked at attendance rates during the spring distance learning time, and we targeted 4 school pyramids across the district. And using those 3 data points, we gathered from Fort Worth ISD a list of all of the students that met that definition of target population. And we mobilized community partners. We put a big call out to say, you know, if you would like to be a part of this movement with us, please do. And we gathered trios. We called them our team trios or something, that included on every trio a member of the Fort Worth ISD staff, particularly teachers from the schools in those pyramids. Every trio had a social worker, and every trio had what we called a neighborhood champion. And this was part of our strategy to make sure that these porch visits were received with warmth and welcome and joy and kindness. I use this a lot to say, you know, when the Amazon delivery person comes to my door, I don't even open the front door for them, and they have their Amazon uniform and truck. And so somebody showing at your doorstep, it is unlikely that the door will just be open. So we were really trying to strategize around how do you make sure the doors are opened when we come. So we called in advance. We had that friendly face from somebody in the neighborhood school. We had that friendly and trusted neighborhood champion giving credibility to the work we were doing. And we, on the calls prior to coming, as well as the porch visits themselves, we had a script that we used for every family that was really assessing the health and safety of everyone in that family, including the parents and the children. And we delivered to each home instructional materials that were specific to the age and grade of the child. So if you were a first grader, you got your tote bag filled with instructional materials specific for first graders, activity sheets on how to use those. They included magnetic alphabet letters, whiteboards with markers, flashcards, and again, all those materials that were specific to the age and grade of the kid to complement learning. I think some of the things that we found were, first and foremost, when we visited families and we collected data from visiting them into a data portal, what we heard time and time again was that they felt truly cared for, that they said life is hard and there are more struggles, and they felt like this was a tremendous act of kindness, that somebody would care enough about them to call them and then to show up on their front porch with the things that they wanted. if a family told us that they needed something when we were on their front porch, we followed up with those materials as well. A lot of that had to do with food. Some of it had to do with basic needs resources. Some of it had to do with getting children a home medical doctor. I'm not quite sure those three words were put in the right order, but basically a primary care physician for their child. And again, all of this was done in partnership with, Cook's Children's, our social ACH, Children and Family, communities and schools, all of those people who serve those key roles. And so we heard that time and time again. We also heard from families where we might be there visiting with the intent of talking about the family's, fourth grader, because that's who the district, based on our equation of what made a targeted student, the family also had other kids in the home that they were concerned about. And sometimes from the parent's perspective, it wasn't necessarily that child we were showing up there for, but it was somebody else in the household. And so we really worked then to make sure that every porch visit we did in our second round in August, we were providing a bigger toolkit of resources for families that encompass not only that child we were there to target, but also everybody else in the home.
Can I chime in here real quick? And I know you've heard too much from me already, but I have to tell you, the phenomenal thing about this, obviously you just heard from Elizabeth, and think about how comprehensive and this approach was. But this all started in May when the Associate Superintendent for Fort Worth ISD Schools shared with us that she was worried about all those kids she hadn't laid eyes on yet. So that was the problem. And she just shared it in a discussion. So Elizabeth put her thinking cap on, started talking about this, and within a month, all these resources were mobilized and deployed in such a holistic way. And I think it just shows the importance of being responsive and flexible and really willing to take a risk to do something to meet families where they are. So good job.
Thank you.
And could I add one thing there, Rose?
Yes, absolutely.
Let me say this about school openings. It's such a complex subject. On the other hand, one thing that has been seared in my mind since I served on the Sunset Commission maybe 6 years ago for the state of Texas, in that year, I think 6 years ago, there were 87,171 cases of reported child abuse. And roughly 80% of those reported cases were from school personnel who were reporting what they'd observed in a child's physical appearance or otherwise. And as we all know, schools are more than places of learning. They are also places where people get food, they get comfort. And we're all going to have to deal with the fact that it is inevitable that our schools are going to open and close and open and close. We're going to have outbreaks. We're going to have surges. This is going to be a long haul, people, and we're going to have to be flexible and disciplined, but it's important to our society. And we're all going to have to support our schools and work for the common good, because it's critical to our society, it's critical to our economy.
Yeah. So true.
And it's critical to our children.
Yeah, so true, Tom. And I think that's a good place to leave it today. I think that does conclude our questions, but I want to underscore what Rose was just saying about how, problems presented themselves early on this. And I think that the quick response and the collaboration, and to Tom's point, the interconnectedness and people coming together, those public-private partnerships to solve problems, can be said for education and the work that Elizabeth has been doing with the Fort Worth ISD, but it certainly can be said across all of the critical areas that we have talked about today. It's definitely being seen in healthcare, in our economic development, and our workforce solutions. So our speakers have been on the ground working on this, but so many other people on this phone call also have played a huge part in the response in our community. So it's a thank you to everyone for the part that you have played and will continue to play because this is a marathon and not a sprint, and there's still so much work to be done. So if there are no more questions, I think this brings us to the end of our Q&A. Again, thanks to our speakers for staying on the line, and we hope to see you in September for our T3 event that we have coming up, the next one in our virtual series. Thank you.
Thanks, everybody.